Hi there, everyone. It's Dr. Manu Gill here with another episode of the Holistic Health Protocol. Revitalize yourself today to a healthier mind and body with whole being wellness. For those of you who are new here, we do these health summits because we want to make education, especially in the space of health and wellness, accessible to everyone. And what we talk about is usually aspects of your physical health, your mental health, your spiritual, and your emotional. And we bring on experts in the field of health and wellness, whether they be doctors, they be chiropractors, naturopathic doctors, or just other people in the health and wellness space. We want to bring experts who work together with individuals that they're helping and really making a change in those people's lives. And today, I am accompanied by a new expert, Dr. Christine Arseneau, and I'm really thrilled to have her in this space. And for those of you who don't know who Dr. Christine is, she is a pharmacist, a functional medicine certified health coach, author, and speaker who specializes in Lyme and autoimmune pain and other complex health challenges with over 15 years of experience in this space. So we're here today accompanied by a person who knows how to deal with these complex issues. So Dr. Christine, thank you so much for being here. I really appreciate your time, and it's just
Yeah.
great being here and sitting down with you.
Yeah, you're welcome. I'm happy to be here.
Yeah, the first question I usually ask all my experts is just give us a little introduction of who you are, what really got you started in this space, and what gets you motivated each day to really go make a change in the individuals that you're serving.
Yeah, I've always been pretty passionate about holistic health. I was trained as a pharmacist, so my doctorate degree is in pharmacy. And I've also went on to get certifications in functional medicine, health coaching. I've always leaned toward more of that holistic broad view. So the whole pharmaceuticals to treat every symptom just didn't really align with what I most wanted. So I had my own personal health journey with Lyme disease, and that's one of the reasons I'm really passionate about that space. A lot of pain, fatigue, brain fog, and those are the things that I help people with. And just being able to transform people's lives is why I do what I do, being able to actually see those changes in a much deeper way than when I worked in the pharmacy and was just dispensing medications.
Amazing. So you mentioned that you had your own experience dealing with Lyme disease. So can you share like what that experience was like for you? When did the symptoms start? How many years ago was it? And how exactly did you find a way to heal yourself and move past that?
Yeah, it was a pretty long journey. I had it for 20 years before I was diagnosed. So I got the diagnosis when I was 29. I had been bit by a tick when I was 9 years old. At that point, I had a lot of things going on in my health, a lot of imbalances, a lot of other infections. Typically, when your body has one infection, it suppresses your immune system and allows for other infections to happen. I was pretty sick by the time I figured out what was going on. So it took me 4 years of really concentrating on my health. And during that time, I did a lot of research, a lot of soul searching, a lot of questioning the way that I see the world, and realizing that I had to unlearn a lot of things I learned to become a pharmacist in order to actually heal. I realized it's not just about the physical body, but we have a mental body and a spiritual body and an emotional body and all these other things that we never talked about in pharmacy school. So it took digging much deeper for me to finally be able to resolve all my symptoms.
Wow, amazing story. And thank you so much for mentioning there's aspects of your physical body, your mental body, your emotional body. These aren't things that we actually learn conventional approach. Like even in medical school, for me, these aren't things that we talk about because I guess they're not very rooted so much in science, but there is a science behind them. So I really hope that one day it's taught more in curriculums when people go into more conventional approaches. And it's just amazing that you had to do a lot of soul searching, you had to do a lot of digging, you had to find ways that were tangible for you to actually you figure out what's going on and then heal from that. And I feel like what a lot of people in the space of holistic health, whether they be an MD choosing the path of functional medicine or integrative medicine, or a chiropractic doctor who wants to learn more about these naturopathic approaches, everyone has some type of challenge where it usually takes a lot of inner work, soul searching, and either there were problems in them or someone around them that these people realize that maybe the conventional approach isn't for me or this person. Is there something else that's out there? Is there something else that may help? And if there is, then we have to take responsibility to go find it, which is what you're saying here. And that was part of my journey too in this. So amazing story. Thank you so much for sharing that. And another question I have for you is, can you explain in your perspective or your experience, what exactly is holistic health and why is it so important for people to start incorporating these methods?
Yeah, I would say like the broad view of it is holistic health is looking at the whole person. So it's not, again, not just the physical body, but all these other factors. And I would say there's a lot of different modalities within holistic health, within alternative medicine, but really it's not seeing it as an alternative and seeing it as an and. It's not conventional medicine, or it's you can do more than one thing. You can use conventional medicine when it serves you, but if you only rely on one thing and you're only using pharmaceuticals, they typically only mask symptoms. They don't get to the root cause, and you're missing the root cause. And that's what you need to actually heal instead of just relying on a pharmaceutical. So it's realizing that stress and our mindset and our environment and all these other things affect our health, that it's not just one diagnosis or one symptom and one thing to take for it, but
Right.
even our emotions and our thoughts can affect like the pain that we're experiencing in our body. So it's really just this whole encompassing view of all the factors that affect your health and your life, really.
Yeah, thank you for saying that because it's true. It's not that one approach is so much better than the other. I think we have to start looking at conventional approach and holistic approach without comparing them. Like they both have their own purpose and their own place in the world. If you today get into an accident, you're going to need to go to an hospital and get fixed by a surgeon, right? So that's where the conventional approach is going to work. It's going to work in an acute setting. But the holistic approach will keep you alive for a much healthier, for a longer period of time, but it's not necessarily going to reattach your severed limb today. And one thing I've noticed a lot, and especially as we progress, I guess, year by year, is that holistic health, I think, and integrative medicine, functional medicine, they have an approach where they are being more exposed to the world and people are learning of the benefits of them. But I do see sometimes that people often demonize conventional medicine, maybe pharmaceutical methods. And I think that we need to notice that we shouldn't demonize one approach and put the other approach on a pedestal. We need to actually use both in conjunction where, you need both. You can't just have one without the other. So I think it's great that you said that. So now hopefully people can see that through your experience as a pharmacist, like they'll know that there's a time and place for medication, and then there's a time and place of not using medication. And it really just goes to an individualistic approach because everyone's going to need a different protocol or type of treatment or a health plan than someone else would. So thank you for sharing that.
Yeah, exactly. Some people are like really prefer more natural and they don't want to put pharmaceuticals in their body. And other people do. And if you're able to help somebody no matter where they are in the spectrum, then that's really
Right.
useful. You really need an individualized approach to get somebody to that next level.
Yeah, exactly. And can you share specific examples of maybe some of the individuals that you've served, like of how like these type of practices using a more integrative or holistic approach has really helped the clients you serve or your patients?
Yeah. So let's see. One example recently was I had a client, Carrie, who was able to really decrease her use of Advil. We switched her over to some natural supplements. So we worked on her inflammation through some supplements that were easier for her body to tolerate, and also the lifestyle changes. So she really was able to manage her stress better through yoga and breath work. And that really helped to shift some of her symptoms as well. So she was just having less pain. I had another client recently. He came to me with brain fog as his biggest issue. And we were able to overcome that in just 3 weeks by just making some simple tweaks to his supplements, but also the lifestyle piece was really huge for him. So it really just takes one or two changes and you can really start to make some shifts quickly.
Yeah. And with the individual that you helped with getting her off Advil, can you share like what kind of supplements may have been changed?
Yeah. So she was using it mostly for headaches. And so
Mm.
we put her on feverfew and butterbur to help with the migraines. We also put her on some different anti-inflammatory. So there's a supplement that helps with redox signaling in your body. It's a really good anti-inflammatory. And then some proteolytic enzymes as well to help her with inflammation.
Amazing. Thank you for sharing those examples.
Yeah.
And in your practice, when you're helping these individuals that you serve, how are you integrating different modalities, maybe such as conventional medicine, holistic therapies, and self-care practices to really serve these individuals?
Yeah. So as far as the conventional, so I'm a pharmacist, not a medical doctor, so I don't actually prescribe pharmaceuticals, but sometimes I may provide education or recommend, especially things like low dose naltrexone, like maybe you should
Mhm.
talk to your doctor about this. But what I do is a really comprehensive review of all of their medications and supplements. So I look for any interactions because a lot of times this can be missed, especially it's a pharmacist's job to look for interactions. But if somebody's going to multiple pharmacies or if they're getting things over the counter, then those things just aren't being checked.
Yeah.
So I look for medication interactions, but also medication supplement interactions and also duplication. Sometimes people are on supplements that are pretty similar, they may not be needed. And so if we can add a supplement that has a different mechanism of action, they're going to be able to shift their symptoms quicker. So that also medications can deplete your body of certain nutrients. And a lot of doctors aren't aware of that. A lot of pharmacists aren't even aware of that. So just making sure that somebody is repleting anything that is being depleted by a substance that they're taking. So that's the conventional part. And I also help people navigate their doctor's visits, the route that they want to take with their healthcare providers. A lot of times I just provide support with that. And then I look at things through a functional medicine lens where we're looking at the person as being the center of their care. So I'm not just telling them what to do, but we're figuring out what's best for that person by asking the right questions. And I offer effective supplement recommendations, things that are more natural. And then the self-care, the habit, what I call them habit hacks. And so that's where we focus on, usually it's simple tweaks. I like to come from an ancestral viewpoint where I explain how our lifestyle that we live right now is a lot different than our ancestors.
Right.
There's a lot of information in the world because of the way that we live.
Mhm.
So we make simple tweaks and really focus on those lifestyle changes that are going to be sustainable, easy for people to implement. And then the subconscious mind is a huge piece. So I do a lot of work. We have both the mindset, the conscious mind, and the subconscious mind. And the conscious mind only makes up maybe 5 to 10% of our results, where the subconscious mind is responsible for over 90%. However, the mindset is still really important because the conscious mind and the subconscious mind actually have to be in agreement in order for you to change your habits. So we work on the mindset piece too, because
Mhm.
you have to live with your mind every single day, and that's going to affect your healing if you have negative thoughts. But the subconscious mind, that's where the magic happens. And so I like to craft what I call a magical mindset, where
Mhm.
we just remove any blocks in the subconscious mind, help people overcome things quicker and easier, and help
Mhm.
them, again, make those lifestyle changes. It's a lot harder for them to implement things when we work on the subconscious mind.
Amazing. I love it. And when you were talking about the ancestral techniques, are you getting people to incorporate methods like grounding, getting sunlight, trying to eat more, maybe raw foods or more nutrient dense foods?
Exactly. Yep. That's a big part of it. Just reconnecting with nature. Like we're so divided from nature, being exposed to light at all hours, not getting the fresh air, the sunshine, our feet connected to the earth. Those all really impact our health. And I think a lot of times those things are overlooked.
Amazing. And I don't know if this is true or not, but I do believe in the effects of grounding. It's very amazing. But do you know if there's an advantage as well if we get on all fours, like even use our hands, or do we just get the benefit using our bare feet on soil or sand?
Usually we get enough benefit with our bare feet. So I recommend 30 minutes a day, but
Okay.
some people don't like to be barefoot, especially because I work with a lot of people who have Lyme disease, and some people are scared to be outside in nature because of ticks,
Mhm.
which
Yeah,
I
understand.
work with them on that because fear is really bad for your immune system. And we work on overcoming the fear. But until we get there, I recommend if you don't want to take your shoes off, just touch trees, touch rocks, just do whatever you can.
Yeah.
But they also make grounding material, like you can get moccasins or certain grounding shoes and wear those outside. So there's
Hmm.
plenty of options.
And another question I have for you is what do you believe are some of the biggest challenges or barriers that some of these individuals may face when they're trying to adopt a more healthier, holistic approach?
resistance from others. It depends on the circle that they live in. But if their family lives a certain way and they're trying to be different, be the one that mold and do something different, then you have to overcome that resistance. You have to be secure enough in your choices that you're making that you're able to do them even if the people around you aren't. And there's probably judgment from those people.
Yeah.
And just change is hard. So especially if you're doing things like not watching TV, getting off social media, going outside, like there's going to be the outside world that kind of tries to bring you back in. So you do have to be really strong in your desire to change.
Yeah, change can often be very difficult when we don't have that social support network around us. It's it can be done on our own too, like a lone wolf, but oftentimes it's very hard just getting that motivation, that intrinsic drive to just get something done on our own, with us being our own biggest, I guess you could say, cheerleader or fan. It's much easier when we have those people. So I can definitely relate, and I can also understand that, yeah, that definitely is a big barrier, just not having that strong social network. And some people may also wonder, but do you think that finances may also be a limiting factor or a barrier for people to try incorporating these methods?
I think people think it's finances, but really it's a value issue. So people expect that their insurance is just going to cover their health, and they don't want to value their own health enough to actually pay out of pocket for it. We don't spend a lot of money on our diet compared to other countries because we don't value that. But really, if you value your health, then you're going to spend the money for better quality food. You're going to spend the money for better quality healthcare, because otherwise what's covered by insurance is really just sick care. It's not healthcare. It's not going to help you get to your optimal version of you. So you have to actually value personal development and health. And then it's really not a barrier. It just takes that mindset shift. But
Mhm.
yes, a lot of these things can be pricier than a typical doctor's visit if you have insurance. Now, if you don't have insurance, a hospital stay is extremely expensive. But if you're used to insurance paying for everything, it seems expensive until you make that shift in your mind.
Thank you. That was a great answer. And just a follow-up question is, can you share some practical tips to the audience of how they can start just incorporating some of these integrative methods into their lives just to live and be more optimal?
Yeah, I would say like grounding, like you mentioned, is probably a good place to start because that's free. You just go outside,
Yeah.
take your shoes off, and it has many benefits because it's you're picking up the electrons from the earth, and that neutralizes free radicals in your body. So that actually helps instantaneously reduce inflammation, reduce pain in your body. But it also, you're getting fresh air and you're getting sunshine, most likely. And a lot of people are deficient in vitamin D.
Yeah.
And you're also being more mindful. So if you're outside in nature, unless you're like on your phone or something, I recommend doing it without being on your phone.
Yeah.
If you're just being mindful of your surroundings and you're in nature, then you feel that connectedness to nature and
Mhm.
you're being present, which is essentially meditation. Mindfulness is a form of meditation. So if you can be fully present while you do it, that has an even bigger benefit.
So when you're recommending your clients to go outside, get fresh air, grounding, are you also getting them to maybe do breath work or maybe a type of meditation where they're just present or focused on the breath? Or do you just want to get people to just go out there and just get barefoot?
Yeah, it depends on the person. So if we can stack more than one habit at a time, then that's even better. But if
Mhm.
somebody's just starting out, then I just want to get them in the practice and I won't give them too many things to add. So usually we'll start with one thing and then we'll layer things on. And then if they're like, if we're working on breath work or mindfulness or something else, then it's, oh, you could do that while you're grounding. And once they have that one habit already formed, it's easier to add another layer to it.
Yeah, I guess that really works out well because you don't want to get people to be overwhelmed and just stack so many things on where they might get flustered and be like, "Oh my God, now there's so many things to do." Whereas if they do one thing at a time, it's easier just to build up on that and then do multiple things when they have that practice already in place. So that's a great tip. Thank you.
Yeah.
And how do you see this field of full medicine, integrative, holistic practices? How do you see this evolving in the next maybe 5 to 10 years?
I think it's just going to explode because I think people are realizing that there are deficiencies in our medical system, and that especially people that have been told we can't do anything for you or you need to take this medication forever, and specifically if they have bad side effects to the medication or it's not working for them. And we have all this information at our fingertips now. People are researching, people are discovering these other ways. So I think it's just going to get bigger and bigger. And I think, like you said, people can use conventional medicine when it works for them, but then they are realizing that they have these other options when what they're doing is not working.
Amazing. And currently, can you share any ongoing research or projects that you're involved with within this field?
Yeah, so I'm always evolving my programs. So I work with clients. My programs really focus on inflammation, reducing inflammation in a natural way. And so it's almost like I see every client as a project. I have my framework, but I'm always looking at what's going to help this one person the best. So I'm always adding to it, or maybe taking things away so it can be as simple as possible, and just always optimizing it and always learning along the way, always researching.
Thank you for sharing that. And how do you believe the COVID-19 pandemic really impacted the field of conventional medicine, holistic health? And how do you think it's just changing the way we approach healthcare going forward?
Yeah, again, I think it's just like strengthening the idea of holistic, because when it comes down to it, if you focus on resiliency, if you focus on making your body as strong and resilient as possible, that's going to help you no matter what viruses come around, no matter what bacteria you're exposed to. And the best way to conventional medicine is for when you're broken, you need something fixed, but it's not for optimal health. And so I think people are realizing that there's a lot of things that they need for optimal health, like stress management and different things, and that our healthcare system just isn't built for that kind of thing.
Yeah, I've seen those challenges too. And it's just a simple thing sometimes that getting people to start meditating, journaling, praying to God or the universe, whatever they believe in, just developing more social interactions and developing those more tighter bonds with their family, their friends, just being more present. And I guess just like starting to do more simple things like go for a walk, go outside, go be in nature, go play with your pets, go be with your children, whatever it is, right?
Yeah.
Start eating more healthy, take more control of your own health by really like realizing and becoming conscious of what are your daily thoughts, what are these recurrent thought patterns each day, what are you putting in your body, are you actually conscious when you're eating, or are you just mindlessly putting food in your mouth? So I
Right.
think I'm really looking forward to see where this field goes and how many more people will come out, will advocate for it, and just start sharing more stories of how it's really impacted their lives. We'll see where it goes, but I think it's going to be, like you said, it's just going to explode and just go up from here. So hopefully.
Yeah.
And can you share like what were some of the most impactful stories you've had of your clients that you've helped? Like which ones really hit close to home, and what were like the ones that were the biggest wins for you just incorporating these methods and helping these clients?
Yeah, I think when they have results so quickly, like they come to me. So I typically work with people for at least 3 months. That's my
Yeah.
minimum when somebody comes into my program. And they come in with like these health issues. And sometimes we get them so much better so quickly that by the end of the program, we're working on business and the limiting beliefs that they have around growing their business and how they show up in the world and like all
Yeah.
these other things. We're not even focused on health anymore because we've gotten them to a much better place.
Yeah.
And again, like it's all holistic. So even though I'm a health coach and health is my real expertise, a lot of times I do help people with career changes, growing their business, moving to a different location, because in the process of getting well, you're uncovering your life's purpose, or you're realizing that you're stuck in a career that's not fulfilling you and that's affecting your health. So I think it's like the uncovering of all these other things, and just, yeah, just when I can see people's lives changing so drastically. And my clients are amazing. It's all of them. I'm just drawing out, what's inside of them already, but just seeing them come to these realizations and realizing like how big of a change that they need in their life. And
Yeah.
yeah, that's really fulfilling.
Yeah, I feel like it's just one of those things. How you do one thing is how you do everything. So it's like when you start on peeling the layers of the onion and getting to the core, it's going to translate to all other areas of your life. And it's like you said, you're a health coach, you went to school for being a pharmacist, but at the same time, when you're helping everyone get better in the realm of health, it's gonna translate to other aspects, whether it be relationships, their finances, career change, or just the intention they live with. So I think that's just amazing how literally one thing that you do will translate to everything. And that's great that you're able to help these people out in that way.
Yeah.
And
Yeah.
one more question I have for you is, I'm pretty sure the audience is going to want to know this, and I want to know this, is how do you take care of yourself on a consistent basis? Are you rigid in your routine with your diet, or are you flexible with your exercise routine, your nature routine, whether that be grounding, whether that be just getting outside, fresh air? Like, what exactly are you doing in a day, and how do you keep yourself going?
Yeah. So for me, the morning routine and bedtime routine are really important.
Right.
So I start my day off with affirmations. So I record affirmations on my phone. I listen to those. I write in my gratitude journal. And I just like really take a few minutes to set my intention for the day and what I want to happen. That's really important for me, is how I start my day. I'm always getting outside when I can. We've got two little puppies and
Yeah.
we're still potty training. So we got to take them out every hour or so.
Yeah.
We also have a bunch of birds. So we have a lot of animals. And so I'm outside a lot. I'm with the animals. It's like living in the present moment. I have so much gratitude because I'm able to do that. I'm able to stay home with my dogs and my animals and still work. I'm not stuck in a box in the pharmacy, like literally stuck in a box like I used to
Yeah.
be. So the nature is a huge thing. So when I walk the dogs outside, I take off my shoes and just connect, just be like so grateful for the life that I have and that I have this flexibility right now. And then at night, I usually take a bath, unwind, and just, I love going to bed early. I love getting up early. I'm pretty regimented with my food. I recently went back to gluten-free and dairy-free. I had been more lax for a while. It's really the quality that I really focus on. Most of the animal products that we eat, there are our own animals that we raise or that friends raise, or my boyfriend fishes. So we're eating fresh, clean sources of animal protein, organic fruits and vegetables, and not so many carbs is how I feel best. Yeah, just trying to do things clean, simple. We don't watch TV. I use social media to connect with clients and that kind of thing, but I hop on and hop off. I don't scroll aimlessly. So just being
Right.
really careful. I don't let a lot in my mind. I kind of live outside of what I call the matrix. So I don't let the news and social media and what other
Right.
people are doing and everything influence me. I just really focus on that happiness within and being in nature, being around my animals, being in the present moment.
Yeah.
And then I try to move my body regularly, yoga and just walking as well. I love walking on the beach. I don't live far from the beach. And
Oh, you're
again,
lucky.
yeah, yeah. That, yeah, even before I lived in California, now I live in Florida. I switched coasts, but it's like I
Yeah.
have to be near a beach. I realized actually, because that was important to me in my healing journey, I moved as well because I was in Michigan before that. And I
Right.
realized cold weather made my body hurt because I had
Right.
Lyme. And I realized how happy the sunshine and the beach makes me. So that's something that's important to me. And yeah, meditation. So I usually do a self hypnosis or a meditation of some sort every day as well.
Amazing. And do you incorporate maybe like a type of fasting, like in intermittent fasting, and also deliberate heat or cold exposure in your routine, like maybe using a sauna or getting in an ice bath?
So I haven't done sauna lately. I did that. I used to do that pretty regularly. I do get massages regularly, and I probably need to get back to the sauna actually because I really enjoy that. So yeah. And then I fast from time to time. Right now, like before I was doing keto and intermittent fasting in a more structured way. Now I'm a little bit more lax with my diet, but I do fasting like from time to time. Just, oh, it's late. I don't want to eat dinner. I'm just going to fast today, that kind of thing. So I'm not on a really structured schedule with that.
Okay, amazing. Thank you so much for sharing that. I'm pretty sure it's going to gain value from what you shared, and I'm gaining a lot of value from your routine and seeing how I can incorporate some of these things into my lifestyle. So thank you for sharing.
Yeah.
And before I end the interview, I always ask my experts two questions, and I'd like to ask you those to you too. So the first is, what is the single piece of best advice you've ever received in your life? And the second is, what is the single piece of worst advice you've ever received in your life?
Oh gosh, let's see. I think the best advice would be that we create our reality, that our inside world actually creates our outside world. So our thoughts and our feelings are not describing our situation, they're actually creating it. And so when you know that, that to your like deep to your core, that's huge. That changes your life.
Right.
So that would say that's the best. The worst advice, maybe the worst advice would be like to keep being a pharmacist because that's the safest thing to do. That's a good career, and you worked hard and you spent all this money on school and you got a doctorate and you're just going to give that all away.
I can relate to that. Yep.
Yeah, it's like I'm not going to do it. I'm going to do what I can still use everything I learned. Like I'm still
Exactly.
registered as a pharmacist, but I like to joke and call myself a recovering pharmacist because I just don't work in that typical pharmacy world anymore. So do what you love. Don't do what you think you have to do or what other people think you should be doing.
Amazing, because I can definitely relate to the best piece of advice and the worst piece of advice. And you're right. You have to, in order to shape your reality, it really begins from within. Like outside every day it can be beautiful or it can be miserable. And regardless if it's a sunny day or a rainy day, some people might find joy in it being rainy, whereas, oh, it's rainy, it's not supposed to be a nice day. And when it's supposed to be sunny, oh, it's supposed to be a nice day, but someone might be totally miserable. But it really just depends on what's going on inside that really shapes the external. And with the worst piece of advice, yeah, like definitely you have to do what makes you excited to get up out of bed, how you can serve in whichever way that means to you, and a way where you're able to monetize off a career that's really giving you that joy inside. Because there's a lot of people in the world that they went to school for a certain degree, a certain career path, they follow that career path, they do it, but they're not truly happy. Some people may be happy, and that's amazing. Stay happy, do what you got to do. But then other people, they're not finding that fulfillment. So I really think what you said is super key, that you need to do something where, regardless of your degree or what you went to school with, it's what are you excited to get up every day out of bed? What are you excited to change in the world or in the community around you or even in your own home? It doesn't have to be big, but what are you excited to do? So thank you so much for sharing that. That's very valuable advice. And I hope, people that are listening are really taking that into heart and knowing that they're on the fence of wanting to change careers because they find fulfillment and joy in maybe being an entrepreneur or something, or finding something else that they can serve with. Then take that plunge. It's scary, but it will work out as long as you're committed and focused and dedicated to getting that done. So thank you for sharing that.
Yeah, you're welcome.
And I just want to say, before we finish the interview, thank you so much, Dr. Christine, for being here. I really appreciate your time. And to the audience, I appreciate all of you for tuning in, listening to another episode. And Dr. Christine has been super generous to offer all of you today listening a free gift. And Dr. Christine, would you like to share what this gift is with the audience?
Yeah, so it's an inflammation quiz. So you can see how inflamed your body is, because inflammation is the root of a lot of chronic diseases, pain, fatigue, brain fog, a lot of the things that a lot of people are suffering with. And the quiz will let you know how inflamed you are. And then there is also a mind-body meditation that you'll get after you get your quiz results that will help you reduce stress, because stress and your thoughts and your emotions all affect the inflammation in your body. So the meditation will help you feel relaxed and get some better sleep as well.
Amazing. Thank you so much. Everyone listening, I hope you guys take advantage of Dr. Christine's gift and go click on it and go show her some love and just go hit her up on her socials, her website, see what she's about. And Dr. Christine, where can people find you? Which socials are you on? Is it your website, or are you on Instagram, TikTok? Where can people find you?
Yeah, I'm on Facebook under my nickname, Tina. So Tina Arseneau. And yeah, I'm not on really anything else, but my website is lymesupport.com.
We're going to put everything in the show notes, guys. Dr. Christine, her website, her Facebook, and the free gift. Also, all of you guys can go click and see what she's about. I just want to say thank you so much again, Dr. Christine, for being here. The audience, thank you for listening, for supporting the Holistic Health Protocol. My team and I, we all appreciate you. And I just want to say, we have more experts lined up and more episodes in the future that we're going to be releasing. So you definitely don't want to miss those. And over here at the Holistic Health Protocol, we talk about all things health and wellness related, taking control over your spiritual, your physical, your emotional, and your mental health. So we definitely don't want you to miss out on these opportunities. We want you to be here for the next episodes. And until next time, I want to thank all of you. I want to thank Dr. Christine, and we're signing out for today. Thank you.